How do I differentiate that this chest pain is due to cardiac problem or not? The echo is okay. The pain is of a huge variety in its nature and comes and goes randomly while even sitting. Well, Rahul, that is a great question. If I could tell you the number of people that have, and the number of doctors that have just driven themselves crazy trying to differentiate chest pain. As you know, or may not know, there's more and more focus on medical technology to figure out, how do we know for sure? One of the most common things now is enzymes, what they call cardiac enzymes. Those are enzymes found in the actual muscle tissue of the heart. It's similar to enzymes that you see with liver enzymes. When you're looking at somebody taking a statin, if you see enzymes from the liver, it indicates irritation or injury to liver tissue. Just like if you see cardiac enzymes, it indicates irritation or injury to the heart again. But that's not the only thing. It is a Gestalt, if you're familiar with that term. Gestalt was, I think, a psychological scientist who made the point that, look, the whole is greater than the sum of the parts. So unfortunately, there is no really good single individual test. You know, we talk about that a lot with other things. For example, cardiovascular inflammation testing. People say, well, you know, what's the one test for cardiovascular inflammation testing? Well, if you look in research channels, the one test that most people use, Gavin Blake, Paul Ridker, the guys that made this whole concept famous within the medical scientific community, they started looking at it. They still tend to do one test only, C-reactive protein, and now HS, or high sensitivity C-reactive protein. Somebody was asking about the difference between C-reactive protein and HS-CRP. CRP is what they look for on large studies, but I tell you, with a single individual patient, I don't look at that alone. Why? Because it has too many what we call biological false positives. If we did a flu vaccine on 100 people today, 2 days from now, 66 or more would have a positive C-reactive protein. Without diving and going too far down that bunny hole on C-reactive protein and cardiovascular inflammation testing, I'll just say, just like the test for, is this chest pain due to my heart or not? There is no individual good test, so there's a lot of tests. Do I have cardiovascular inflammation? There is no single individual test. So there's a lot of tests for that. That, unfortunately, is life. Most people that are searching around for a quick answer on the internet don't like complications. Unfortunately, life can be complicated.